Throughout this forum today, we talked about improving health outcomes for dual eligibles. We talked about partnerships and advancing health equity with housing. This panel really is going to serve in terms of providing that overview of what a national plan on aging is going to look like. We have several different perspectives on this panel, and it will really set up the stage for a great conversation and discussion, and I believe kind of pave the path forward in terms of not just what we're going to be doing at the national level, but what the state of Massachusetts can also be doing for the future of older adults. So without further ado, I'm just going to go ahead and jump right into it. And I'm going to pass this first question to Jennifer. We know that the Administration for Community Living put out a national plan on aging and a strategic framework. Could you tell us a little bit more about ACL, Administration for Community Living, and provide some context for the strategic framework and what priority areas came up with it?
Absolutely. Good afternoon, everyone. The U.S. Administration for Community Living primarily serves older adults, persons with disabilities, and their respective caregivers. And for anybody who's not familiar with us, we were created around the fundamental principle that all people, regardless of age or ability, should be able to live independently and fully participate in their own communities. And to achieve this, ACL funds services provided primarily by networks of community-based organizations. We advocate across the federal government for older adults, persons with disabilities, and caregivers, and we invest in training, education, research, and innovation. ACL administers programs under a number of authorizing statutes, including the Older Americans Act, the Developmental Disabilities Act, and the Rehab Act, just to name a few. And our work involves executing grants and programs to achieve these legislative directives. Now, none of this would be possible if it weren't for the Aging Network. So you might naturally ask, well, what is this Aging Network, Jennifer? The Aging Network is comprised of 56 state units on aging, so one for every state, Washington, D.C., and then the U.S. territories, 618 area agencies on aging, 20,000 service providers, 264 tribal organizations, and we rely heavily on over 500,000 volunteers to help us administer the programs that we tackle. The network provides services to 1 in 5 older adults in the United States. So you might be asking, well, how many older adults are there in the United States? More than 55 million folks in the U.S. are age 65 or over right now. And they're also living longer. So between 2022 to 2040, the number of older adults age 85 and older we anticipate will double. And then, on top of that, there's an additional 53 million Americans who provide a broad range of assistance and support for health and quality of life and independence of older adults and persons with disabilities. These are the caregivers. Do I have any caregivers in the room today? Yeah, all right. You know who you are. We'd love to hear your stories, too. As a result, we need to make sure that we can meet the needs of a growing population of both older adults and caregivers, which brings me to the 2020 reauthorization of the Older Americans Act, which included the Interagency Coordinating Committee on Healthy Aging and Age-Friendly Communities, or the ICC for short. If there's anything that the federal government can do, we can acronym anything. So, ICC. ACL was designated by HHS Secretary Becerra to oversee and administer the operations of the ICC, and it truly is an interagency collaboration consisting of 16 different federal agencies and or departments, and we're growing more, adding more folks to our work. And in May of this year, the ICC released a report to Congress called A Strategic Framework for a National Plan on Aging. And since this release, we've been conducting extensive community and stakeholder engagement events with multiple partners. The strategic framework is intentionally aspirational and high level. Its goal is to inspire dialogue at the local, the state, and the federal levels to really build upon existing momentum and work that's being done to make all of our communities more age-friendly, much like the work that's already taken place here in Massachusetts, with the ultimate goal of being able to develop a comprehensive national plan on aging that can be executed. And the vision for this strategic framework is an America that values older adults, embraces aging, and recognizes that all people have the right to live with dignity in their own choices and participate fully in society. The framework is further broken down into 4 different domains, and these domains stem from the statutory authorizing language for the ICC itself. So the first domain is age-friendly communities. The second is coordinated housing and supportive services. The third is increased access to long-term services and supports. And the fourth is aligned healthcare and supportive services. So to find out more, go to ACL's webpage, which is acl.gov/ICC-aging.
Thank you so much for that overview, Jennifer. So the framework, it really does set the stage for a national plan and is based in collaboration, especially collaboration across various agencies. Bree, could you tell us about how Massachusetts could serve as a leader in fulfilling the components of this framework and the future plan?
Sure. So good afternoon, everyone, and thank you for letting us get in the way of now and the time when we go to the cocktail hour. So thanks for sticking with us. No, thank you very much. I've really been super inspired by the conversations today, as I know we all have. You asked about how the Commonwealth could be a leader when it comes to aging in America, and I would first say the idea of a framework for a plan for aging in the United States is one that we're exceptionally supportive of. In Massachusetts, we have a vision for building age-friendly communities that are places where people want to grow up and grow old in. And we see those as places where people can grow older with the support of their communities. They can thrive in their communities. They can feel safe, secure, socially connected. They can live with dignity, and they can make choices about where they live on their own terms. We have already started going down the road. Actually, we've been doing for many years now work on building age-friendly communities that I think aligns super well with the framework on aging. We started back in 2019 with our first age and dementia-friendly plan, and we've had a lot of success in implementing that since then. And 2 of the kind of tenets of the plan that we very intentionally put into place are framing what we want to accomplish as a state together and putting into place the partnerships, the alliances, the venues in which we can work together to make this sustainable over time. And now, looking back 5 years, having achieved a lot of that and moved us along down the road, we are in the process now of refreshing that plan, which is very timely, in line with the framework. So we spent the summer, actually, Secretary Lipscomb talked about this morning, going out to the communities and engaging with members of the communities and the organizations within those communities to hear about what they believe is working, what they think needs to be changed, and what they really need from us, and from us as a system. Because the plan is meant to be something that brings together concerns about housing, concerns about health and wellness, concerns about transportation, concerns about caregiving, and thinks about them as the system that they are. What we heard during these listening sessions is probably not altogether surprising. We engaged with over 600 people in listening sessions. We had almost 300 responses via surveys. The top of the list were caregiving. housing, transportation and mobility, and I'm going to save two because they were a little surprising compared to 2019. So let me talk about those three first. We did hear a lot about housing. I don't think anybody would be surprised about that. It was in line with what we talked about in the last panel, what we heard about in the last panel. But sitting next to people at the tables and hearing their stories really brings it to life. Everyone from the people who are in houses where they raise their families and want to downsize, but if they were to downsize, their new place, a smaller place, an easier to care for place, would be more expensive than the house where they live now. So we know these people, they live on our streets and in our neighborhoods. They stay in their homes because they have to. The homes become, the front yard gets overgrown, the house gets into disrepair, they're living on the first floor, they're walking around the neighborhood trying to keep in connection with other people, and one day they disappear, and someone in the neighborhood goes, well, what happened? Where are they? And you find out that something catastrophic happened in that home. We heard from people who are looking for affordable housing, and there are, of course, long wait lists for subsidized housing. We heard about people who want to be in single-story housing or 55-plus communities who can't afford to go into there or are experiencing wait lists. It runs the gamut. And even for those people who are able to get the supports in place and afford the place where they want to live, it's kind of amusing to me, in an ironic way, that while they have housing or are seeking housing, all that's being put up around them is walls. You may have housing, but transportation becomes key. If you no longer can drive, you get isolated in your neighborhoods. We heard about that a lot. You want to be in your house, but you need help modifying it, and maintenance is important, and you don't know where to go for that, and that becomes an issue, and a wall that's put up in front of you. I think it was Dr. Wong who talked about the house being the anchor point of all the care and society that happens, and that's really true. We also heard from people about caregiving being a really primary concern. The most impactful story that I heard from folks was a man and his daughter sitting at a table with us, and he was, super concerned and upset because his daughter, who had worked very hard and gone through school and gotten her degree and gotten into a great job and was just getting to be successful, had to leave the workforce to care for him. And that's an impact not just in terms of health, but to our economy in Massachusetts and the system where we live, and so that's something we have to address. Two things we didn't hear about very much in 2019 that came out in higher relief, and we haven't really talked about today, are the impact of the environment. Noise concerns came up, but the things that were most, that perked my ears up were how many people said, my heating and cooling bills have gotten really high because the temperatures are fluctuating more than we anticipated for them in the past. We heard a lot of people who said, look, I'm stuck in my apartment because I'm walled in. There are no green spaces for me to go out and have kind of a square where I can meet up with other people and run into other people. We also heard a lot about tech equity. And this one hits home. I'm sitting in the building where I got my degree, a master's in IT, and I know I struggle with how technology changes all the time. Here are people who don't have access to devices, who can't afford broadband, and even if they could, the usability of these devices makes it very difficult, and that's a barrier because that affects their telehealth with their doctors, that affects their ability to, to get services and pull up their health records in a portal. And what we heard, very sadly, is that is causing social isolation because their children and grandchildren aren't talking to them because they can't reach them through the technology of their choice. And what really blew my mind was that the safe part of society that they had counted on, the things that we think about interacting with every day that should be easy, have become hard because of technology. So people who want to fiddle with the thermostat in their houses no longer know how. There are no written manuals for your washing machine anymore. If you want to get your internet fixed, it's difficult to get the person on the phone to understand if you're on a landline. They don't know what to do with that anymore. And so these things that used to be very simple have become very hard. So we heard a lot about that in the listening sessions. We are now taking all of that information. We've pulled out the key themes, and we're working through a series of focus groups where we will be discussing these insights, discussing a policy review we commissioned across the U.S., discussing demographics and thinking about what are those themes that we need to have to work on, put strategies against over the next 5 to 10 years. And I believe that they will align really well and really nicely with the strategic framework.
Thank you, Bree. In your remarks, you brought up caregiving, and I think we saw a few caregivers that are here with us in the room today. And I think we can all agree that when you talk about caregiving, you also are talking about long-term services and supports a lot of the time. So the Blue Cross Blue Shield of Massachusetts, they issued a new LTSS report that paints a comprehensive picture of the state of long-term care in Massachusetts. Catherine, could you share with us some of the conclusions of this report and what are the successes and areas of opportunity?
Yeah, I would be happy to. And just to step back, I want to say a big thank you to Marta and to Colleen. I was going to say thank you for inviting me to come and speak, but actually after having sat through this incredible day and heard so many inspiring speakers and such thoughtful and substantive conversation, thank you for just inviting me to be here. It's really inspiring day. So just to back up a little, I just want to offer a little bit of context about the primer that we just, that the Blue Cross Blue Shield of Massachusetts Foundation released earlier this year. This really came up because in early 2022, we were anticipating the election of a new governor and a new slate of legislative leaders, and decided it would be really interesting to commission a project where we spoke to healthcare stakeholders across the spectrum. So business leaders, consumers, healthcare providers, healthcare plans, et cetera, and asked them, hey, what do you think the top healthcare priorities should be for the next administration? And we put together a report summarizing the top 5 healthcare priorities that came up from those conversations. And one of those 5 priorities that emerged from those conversations was to improve the affordability of and access to long-term services and supports. But what was interesting in having those conversations with those stakeholders and in subsequent stakeholder conversations, people indicated to us that they really felt there wasn't an easy place to go to understand how LTSS are paid for and provided in the state today, and what some of the strengths and the challenges in our LTSS system are in Massachusetts. So we decided there was an opportunity to commission, again, a report that really puts in one place all of the available data we could find on LTSS payers and programs, on utilization and spending, on workforce and workforce capacity, and LTSS quality in Massachusetts today. So that's the primer that we referenced today, and you can find that primer on the Blue Cross Blue Shield of Massachusetts Foundation website. But just to cut to the chase, to give you a sense of what we concluded, after looking at all of the data we could get our hands on, our primer concludes that the state, actually, Massachusetts does a better job than most states in providing LTSS, and we found that there are meaningful opportunities for improvement in the state. So to give a couple examples, we started by looking at people. So who uses LTSS and who provides LTSS in the state? And I don't need to repeat what has been said very eloquently by many people before today about the changing demographics in the state. But what we found is that as the population in Massachusetts ages, there's going to be an increased demand for long-term services and supports, and that is going to put increasing pressure on what we know is an already very strained LTSS workforce. And what hasn't been talked about as much, although I know Bree just referenced this, is that what that's likely to do is continue to put increased pressure on the informal or unpaid family caregivers in the state, which we know our report found already provide 80% of LTSS care in the state. 80% is from informal and unpaid caregivers. But both those and the formal paid caregivers are likely to, and direct care workforce are likely to feel increased strain as the demand goes up. So our report finds there's our report finds that Massachusetts has been working to try to address this. They've taken COVID-19 relief dollars and used that to increase wages for LTSS workers and training opportunities. And that our report found there are additional opportunities for us to think about expanding the direct care workforce and continuing to support informal, unpaid caregivers. For example, our report identifies that there's an opportunity for us in the state, something that other states have done, not Massachusetts yet, is to provide a tax credit to support family caregivers. Okay, so then we looked at care delivery for long-term service and supports in Massachusetts. And this is an area of real strength in Massachusetts. So we found that through Mass Health and most recently, using COVID-19 relief dollars, Massachusetts has expanded access to community-based long-term services and supports. This is an area of real leadership for Massachusetts. So in Massachusetts, if you look at all of our Medicaid funding that pays for long-term services and supports, 72% of that funding goes to community-based long-term services and supports. And that's compared to nationwide, only 62% of Medicaid funding nationwide on long-term services and supports is concentrated in community-based care. In addition, the state has done a really good job at expanding its One Care and its SCO programs. I know we had a panel earlier that talked about the dual eligibles and their LTSS needs and the importance of these integrated care programs that offer care coordination for this population that has high LTSS needs. But we also know that the majority of dual eligible members in Massachusetts are outside of those programs and remain in the fee-for-service system where they don't have access to that kind of comprehensive care coordination. So there's opportunity for growth there in the state. Third, we looked at costs for long-term services and supports in Massachusetts, and I don't think this will surprise anyone. This is a space of particular challenge here in Massachusetts. So we found that costs for most LTSS in Massachusetts are well above the national average. In addition, what I think we all know in this room is that most health insurance does not pay for long-term services and supports, at least not yet. So that includes, commercial health insurance and Medicare. And that only 8% of Massachusetts residents have private long-term care insurance. So what that means for most of us is that when we have significant long-term needs for long-term services and supports, we either have to pay out of pocket, which is extraordinarily expensive, or we have to spend down our income and our assets until we qualify for Mass Health, which can be extremely financially devastating for families who are facing that path. And so our report found that there are opportunities in the Commonwealth for us to think about how do we expand and promote financing options for residents who don't qualify for Mass Health, but whose incomes aren't high enough to be able to pay for these services out of pocket. And I think we can look to the state of Washington, who recently passed such a plan, and we can talk about that more a little bit later. Finally, we looked at overall LTSS system performance in Massachusetts, and we found that Massachusetts is a leader in LTSS. So we ranked 4th among states in LTSS system performance. At the same time as we ranked really well overall, there were specific areas where we could improve. And so that includes, an area related to LTSS safety and quality. So for example, Massachusetts ranks last in hospital admissions among home care recipients and 30th for nursing home residents. We also found significant inequities in nursing home care in Massachusetts. So facilities serving a higher percentage of residents of color are more likely to be underperforming and understaffed. So again, just to back up overall, what our report found is that LTSS in Massachusetts has some very impressive and important strengths for us to build on, and it performed well overall relative to other states. And we identified opportunities for improvement in each of the 4 buckets that I just talked about, in workforce, in care delivery, in costs, and in system performance.
If I can just add a couple of points to that, because I'm really excited about it. We should point out also that Massachusetts is one of the only states in the country that actually has a home care program for those who don't yet qualify for Mass Health, which is a really big deal. And on the subject of helping people afford long-term care, one of the things I'm really excited about right now is some work we're doing to develop an actuarial model.
You're stealing my thunder.
I love this one. An actuarial model that will help us think about how we can perhaps do some public policy around payment options for that long-term care, because the long-term care insurance market is perhaps not as useful to a lot of people as maybe it could be. And we're about halfway through that work right now. We don't anticipate having answers. We just want to build the model and look at all the different parameters and see how they can kind of be, juggled up and juggled down, and what the impacts will be. But I think it's really exciting to think about.
And if I could, is it okay? I'm sorry. I just want to jump in because I did want to speak to this, and I referenced that Washington State recently was the first state to pass a comprehensive coverage of like a private long-term services coverage for people who are caught in that middle and need help affording LTSS. And Washington State, actually, their efforts really got catalyzed by an actuarial study that is very similar to what Massachusetts is doing today. But in order for an actuarial study to translate to public policy change, you need engagement from the affected stakeholders. And so I think it's really important to know that this actuarial study is happening, to get engaged, to understand what it's finding, and to have conversations with your allies, with your partners about this work, so that we don't lose out on this opportunity for action.
See, this is why I always like coming back home to Massachusetts, because honestly, I mean, I'm not just saying this because I'm from the state, but Massachusetts truly is one of the more innovative states when it comes to aging and healthcare. And I think the theme today, everyone said we have to do more, we have to do more. But I do want to take a moment to applaud the work that everyone in this room has been doing as it relates to older adults and ensuring that they're able to age well and in their communities. And we also flagged a lot of gaps, too, that we're seeing in terms of like that social determinants of health umbrella. So we talked about housing, there's transportation gaps, there's tech gaps, there's connectivity gaps. And there are partnerships that are really going to be key in terms of addressing and closing those gaps, particularly partnerships between healthcare and social care. This next question is for all of the panelists here, but I'm going to start with you, Moses. How are current federal policies shaping access to housing and integrated services like LTSS, and specifically, how are these efforts playing out in Massachusetts, and what can we learn from Massachusetts' approach to addressing these issues and other social determinants of health?
Absolutely. First, I want to thank Marta and her team for putting together this forum today, and certainly thank you, Olivia, for moderating, and the other panelists. There's been a lot of talk today about housing and supportive services. Secretary Augustus spoke about what we're doing here in Massachusetts in terms of the housing bond bill, particularly with our older adults. And I would say that there's a couple of things that is happening at the national level. Is how do we put together a plan through HUD, the Housing and Urban Development, and really looking at how do we match what Massachusetts is doing with what the federal government is trying to do around housing. Since we've been storytelling today, I'll tell a story about the area that I represent in Massachusetts, which is central Massachusetts, We're located in the city of Worcester, but we cover 61 cities and towns. So we have both urban and rural and suburban communities. And so Worcester has gone through this renaissance. There's a lot of gentrification over the last couple of years as we've come out of the pandemic. And there was this 83-year-old woman who had lived in Worcester all of her life, rented, and the cost of the rent went up. She was forced out by her landlord. Fortunately, she found housing in a town that was about 20 miles away. That was good. But the problem with that was that she was now 20 miles away from her doctor. She didn't have a car. She didn't have family around her that could get her to and from her appointments. She was away from the community that Dr. Wong talked about earlier. And so from a national standpoint, and even with what we're doing here in Massachusetts with the housing bond bill, it is good that we're talking about housing production and where we should put housing. But we also have to think about our rural communities and the people that have been pushed into the rural communities that may have lived in urban communities their entire life. So what does a housing production plan look like for people that have been pushed into rural communities? Particularly, a majority of them in central Massachusetts are people of color, seniors of color. And, there's cultural differences. And so thinking about from a federal standpoint, when we think about housing, is how do we ensure that we're not just focusing on urban versus suburban, but we need to make sure that we're including the rural communities as well. And I would say what we've done in central Massachusetts, we are the largest area agency on aging in the state in terms of the number of communities that we serve, is from that healthcare perspective, the long-term supportive services. If you now have this 83-year-old woman that I talked about being pushed into the rural communities, and so how do we continue to connect, older adults to services? And one of the ways that we've done it in Central Mass is the partnership with the community health worker organization in Worcester, where we've trained a number of community health workers to be able to continue to work with these older adults who are now maybe been displaced into other communities.
Yeah, if I can jump in. So ACL, we do not fund any building of housing, nor can we pay for rent for an older adult who may need it. But we absolutely are able to provide in-home supports and services. So the connection from the federal level to the state level and down to the AAA level, it is the Massachusetts AAAs and the ASAPs that are essential in coordinating long-term services and supports, as well as home and community-based services for older adults. So ACL's perspective, though, if we don't have the direct authority to do something, we work in a myriad of ways to try to tackle a specific issue. So I mentioned the planning, the ICC, and the Strategic Framework for a National Plan on Aging. We lead in planning efforts. We partner. We have to be scrappy, right? Like, if this is about my population, but I don't have the authority to do anything about it, it doesn't mean I can sit by and watch. So, for example, in 2021, the Housing and Services Resource Center was developed through a partnership between ACL, CMS, SAMHSA, ASPE, and HUD. And ideally, yeah, it's a lot of them. But that speaks to the importance of it. We all have to partner and work together in order to achieve things where either we don't have the authority or we don't have the singular funding to be able to tackle something. If you're not familiar with the Housing and Services Resource Center, check out acl.gov/housing and services.
I'm happy to jump in. I know this question was really about, how we're working to address some of the health-related social needs. And I think, this is a place where I think mass health is really an area of really exciting and innovation happening at Mass Health, and where I think we are, again, showing to be a national leader. So knowing the deep connection between health, health equity, and health-related social needs, Mass Health, in partnership with our federal partners at CMS, has embarked on a number of different efforts in recent years to try to leverage Medicaid funding to help address health-related social needs. And so that's looked like efforts to make sure that we're screening more members for health-related social needs, and even efforts to use Medicaid funding to pay directly for certain social services, namely housing services and nutrition services, for some of the highest risk members in Mass Health. And this is, again, it's a really exciting area. It's a very rapidly developing area. It's innovative, it's relatively new. It's offering new revenue streams for social service organizations, and opportunities to better integrate health and social services, to meet the needs of Mass Health members. At the same time, as this is very, very exciting and there's a lot of promise here, there have been recurring challenges in implementing these programs, and I think they speak to a lot of the themes we heard earlier today about sort of the historical underinvestment in community-based services, and we know that there is sort of pre-existing asymmetries in the resources and the technological capacity between healthcare organizations and social service organizations. And that is playing out in a challenging way as they're working to try to better integrate. For example, social service organizations are now needing to figure out how to navigate, complex healthcare administration and submit claims for their services. There is not one unified way that healthcare organizations refer patients to social service organizations. So social service organizations are having to navigate a huge myriad of different referral systems, all this while dealing with what we know are already pre-existing asymmetries in technological capacity and in resources. And so this very promising effort is it's a big lift for social service organizations and really, really challenging. I think there's a lot Mass Health is doing to try to address those challenges. It's created what we call the Mass Health Integration Fund to help SSOs get the financing to adopt the necessary technology. And they actually recently announced that they intend to procure a vendor to create a unified electronic referral system that hospitals can use to refer patients to SSOs, all of which will help address this challenge. But I do think this speaks back to the theme that Marta mentioned at the beginning of sort of the urgent need for investment in community services, and I think the experience here to date really just suggests the need for as much financial and technological support for SSOs as possible as we work to enhance this type of integration.
Catherine, I think you summed up the past 3 months of my job. In terms of, we're starting at the federal level in terms of ensuring that, again, there's that integration of healthcare and social care, but also for healthcare and other agencies to know that there are challenges in terms of the systems. That is a whole other panel. But we started this panel coming at the top. We're coming at the federal government. And now I want to switch to Massachusetts, and this is going to be a question for you, Bree. Could you tell us why preparing for an aging population is one of Secretary Walsh's key priorities, and what actions are being taken on a cross-agency basis to make sure that Massachusetts is ready and able to meet the needs of our aging population?
Sure. I could go through all the demographics again, or any of the conversations we had before. I will point out, though, that as we see our population over 65 growing, it should hit 30% potentially by 2030. The fastest growing proportion of that is people who are over 80. And there's also a pretty big expansion we see in the over 65 population of people of color, of diversity, of people who don't speak English as a first language, don't speak English at all, or don't speak it well. And so we really do have to think very carefully about not just aging in Massachusetts, but aging in Massachusetts, and the greater diversity in those populations. So when you think about that and everything we've talked about today, it's really clear that being ready for our aging population isn't so much a choice that we have. It's kind of more of an imperative, and we cannot think of it in terms of, oh, are we ready to provide more services in the home? Or are we ready to have more providers who can provide, care for older people? Because that direct care, while really important, especially as people get, above 80, or even into their 90s and 100s, God bless them, that's wonderful. But people over 65 are just people over, we're all aging every day. We're all gonna get there if we're not there already. I know I'm pretty close. We live full lives. And so when we think about being ready for an aging population, we have to be ready in all aspects of the city, and that crosses all agencies. And so that's why Secretary Walsh has decided that, or has named being preparedness for an aging population as one of her key priorities for the Executive Office of Health and Human Services. What we're doing about that is we have begun a number of aging, accelerated initiatives, one of which is the EOEA and EOHHS. See, we can also have lots of acronyms, are working together now to talk with each of the agencies that lies under EOHHS and talk about how ready are they. And it's not ready like, hey, I have 5 months to set the table because I have some people coming over for dinner ready, because this is, of course, already happening. It's how ready are you for that next person to come in front of you who needs help? How ready is the Department of Transportation to think about making our public transportation more accessible? How ready are our is the Department of Housing and Living Communities to think about city planning that helps people be more mobile and helps people get around more easily? Each agency has a place to play, and we want to make sure that we're bringing that aging lens to all policies. Also under that umbrella of accelerated initiatives, we're working very carefully on the issue of family caregiving, because it is so impactful. And we're really excited that we recently were named the winner of an ACL caregiving grant that will help us do some of that work. We're gonna look along a number of things, and we're also gonna look at how we help employers become more aware of family caregiving and how they can support it so that we can keep more people in the workforce for longer. We are looking at financial preparedness and affordability, particularly in healthcare. How do we deal with making applications for our services easier? How do we think about eligibility requirements for those services? Thinking about our long-term care actuarial analysis. And one of the things, again, that just happened was the passage of the long-term care bill, which would fall under this umbrella as well. It really demonstrates the administration's commitment to, when and if someday we need to go into an assisted living or nursing facility, or we have family members or cared ones who do, we want to be able to trust that those places are going to give us the highest quality care and give us the best outcomes, and that the providers who work there have the supports they need in order to do that. So those are some of the things that we're really thinking about under that umbrella of preparedness for our aging population.
And quickly, if I can, because I do want to end the panel, we talked about a lot of challenges and what needs to be better, what is not working, but I do want to make sure that we're highlighting the things that are working and the innovative models that we're seeing. Moses, you and I had a brief conversation earlier in terms of the work that your agency is doing. Could you talk about some of the incredible innovative models that are reimagining service delivery for the aging population with a focus on health equity and some of those creative approaches your agency has adopted?
Yeah, absolutely. You know, I'm a global health practitioner by training, and Dr. Paul Frommer was a friend and also a mentor of mine. And one of the things that I've found as we're coming out of this post-pandemic era is that oftentimes it's not about if we have the tools and the resources, right? It's that we do have the tools and the resources. It's about the delivery of services. And so some of the things that we've done in Central Mass around, you know, caregiver, particularly grandparents that are raising their grandchildren, also known as grandfamilies, is that we created a resource center with the support of our Congressman Jim McGovern. And we're now building what we're calling the Grandfamilies Housing Village of Worcester, which would be in close proximity to the Worcester Senior Center, where you know, it'll be 40 apartments, 2, 3, and 1-bedroom apartments. But we'll also have the services from the Senior Center, the Resource Center, and then we'll also have on each floor the community health workers that will be living in the housing to support the older adults and the children that they're raising. And one of the reasons why we created this model was because we listened to the grandparents and the children about the needs that they wanted. You know, public housing doesn't support, you know, unfortunately, grandparents that are raising their grandchildren because there's certain income limits, there's certain age limits that, you know, a senior, older adult can't have children living in public housing. And so that is the model that we've created. We was just with Senator Warren last week in Worcester to tour the housing project. And it really is a national and a statewide model about how do we care for the 40,000 plus grandfamilies in Massachusetts. And then when we look nationally, there's close to 3 million of these families nationally. And when we're thinking about diversity, equity, and inclusion, oftentimes, you know, we don't think about, or folks don't think about older adults, and we certainly don't think about grandparents that are raising their grandchildren, which are two different populations that need support. And as the housing crisis and the financial burden has gotten greater, these families are feeling the crunch even more. They're dealing with issues of having a son or daughter who's, you know, on opioids or in prison or unfortunately have succumbed to death, right? And so they're dealing with all of this trauma in addition to trying to care for themselves, because as you get older, you have more doctor's appointments. So if you're not able to take care of yourself while trying to figure out how you're going to raise your grandchild, that is a challenge. So having this village model was very important for us to create. And I'll also talk a little bit about our mobile Care Express bus that we just launched about a month ago. And this was launched because of our needs assessments. As Area Agency on Aging, we have to do needs assessments to hear what's going on in the community. And coming out of the pandemic, there were 3 things that we heard from our older adults in Central Mass: housing, medical, and dental care were huge, and vision care. And so we created partnerships with our local colleges and universities. The community college we created a senior dental clinic partnership with them where any senior within the 61 cities and towns in Central Mass could go 3 times a year for free to get free preventative dental screenings. And we took it a step further. We heard from a lot of the older adults who said, well, I may not have transportation. So we partnered with Yellow Cab, where any senior, doesn't matter where you live in Central Mass, you can get a free ride to and from that dental appointment. And so we all partnered with the Massachusetts College of Pharmacy and Health Sciences, where they're providing free vision screenings on the bus where they can make eyeglasses on the spot if someone needs eyeglasses. We partner with the two hospitals in Central Mass that are working with us to do the health screenings for older adults. And this is important because Central Mass is a very rural community, with the exception of the city of Worcester. But having this mobile health clinic for older adults in Central Mass is critical. And I think for other parts of the state and the country that might have similar demographics, I think it is a good model to ensure that we are preventing bigger problems before something worse could happen. And so that is what we've done in Central Mass.
Thank you. See why I wanted to end on a good note for this panel? So I first want to say thank you so much to all of our panelists. This was a wonderful conversation, and I hope that all of you thought so as well. Again, wanted to thank Marta and Colleen and the SES team for not only convening this panel, but convening this forum. So without further ado, I'm not going to talk too much longer because we have good things waiting for us outside. But thank you all for joining us today. It's been a pleasure, and we look forward to really supporting older adults in aging well and at home in the community.